Welcome back to CEO Money. I'm Michael Yorby, your host. All right, it's my esteemed pleasure to bring on Dr. Ellen Turner, dermatologist, dermatology office of Dr. Ellen Turner. All right, Dr. Turner, welcome to the show. Thank you for being here.
Thank you for having me.
All right, my pleasure. All right, give us some background, some color on what your company does, and then also what separates you before we get into what people don't know about skin cancer and the risk, okay?
Sure. Well, we are a typical dermatology office that services both the Dallas area and Irving area. And I think we are a fully comprehensive dermatology office. We specialize in skin cancer, which I think is really what gets most people a little bit nervous, a little bit anxious. We've heard about the dangers of things like melanoma, and that is probably the most serious type of skin cancer that there is. There are other types, though, and I think it's important to distinguish the difference by visiting the dermatologist, and then what the dermatologist would do and what we would do is to actually biopsy or take a small sample of the area in question, send it to a pathology lab, and then we would go to the next appropriate treatment based on the type of skin cancer. So I kind of made mention of melanoma, which is the most serious type, but there are a couple of other types that are caused more by sun exposures over time, and you can imagine we get a lot of sun exposure from the time we're children. Even just driving in the car or riding in the car, we get a fair amount of sun exposure that can eventually, over time, lead to the induction of skin cancers such as basal cell cancer and squamous cell cancers. And these are the types that I think distinguish us as an office in the DFW Metroplex area, because we have a little bit different approach to treatment than what we've always used in the field of dermatology. We've always said, oh, you have a basal cell or you have a squamous cell cancer, you just cut it out. And cutting is definitely one type of therapy, but that's not the only type of therapy that can address basals and squamous cell carcinomas. Now we have a really neat approach, which is completely non-surgical, non-invasive. It's painless, and as a result, it does not leave any type of scar. So now we have the advantage of a wonderful treatment for a very common problem, but without so much trauma that can be induced by surgery.
Is that superficial radiation therapy you're talking about?
It is. And it is important to distinguish. There's really only one manufacturer of this particular device. So this is not going to a radiation center, like, for instance, if you were diagnosed with prostate or breast cancer, for example, you might require body radiation, and that's very, very potent, very high levels of radiation in order to quell those types of cancer cells. But in this case, since it is on the surface of the skin, we can use a superficial type of radiation that was specifically designed by a company known as Sensus Radiation. And it's, for lack of a better word, I've told some of my patients when I'm describing the differences between regular radiation and superficial, the superficial is almost like having an X-ray of your skin, but you have to do it multiple times in order to achieve the proper treatment dose. So it's painless. It takes about 40 seconds to achieve the treatment, but then you need multiple treatments. I think with regular radiation, if you were to try to achieve treatment of a skin cancer using that, and that has been done, but with poor results, number one, and two, it's kind of like trying to, I say, water a garden using a fire hose, for just lack of a better analogy. So that's not really appropriate. And that's why this company kind of stands out, and it has excelled in this area of developing this technology that was specifically created for treatment of basal cells and squamous cells, especially in areas where there's just not a lot of tissue to spare: the nose, the eyelids, the ears.
But Dr. Turner, let me jump in there for a second. From what I understand, and I'm not an expert in this, there's a 95% cure rate for non-melanoma skin cancer with this. Is that right?
That's exactly right.
How is that so? Is it just,
Well, I think it's the technology. They not only developed the technology, but they also went back and they did clinical trials to prove that cure rate, so that at the end of a treatment series, once you're done, you have essentially the same cure rate as though they cut it out and sent it to a lab and checked it. But we don't have to go back and resample the tissue because the company has already done all of those clinical studies to prove that if you reach this level of radiation based on the type of skin cancer and the location on the body, then you're going to have a 95% cure rate, which is outstanding.
Dr. Turner, we've got to close now, but before we go, I want to invite you to come onto our television show so we can do some visuals with this. If you're open to that, I'd be more than happy to extend the invitation.
Thank you. I would be very interested.
My pleasure. All right, we've got to close, but thank you for being our guest. I'm sure we'll talk soon.
Thank you. Bye-bye.
You're welcome. Dr. Ellen Turner, dermatologist, web address, dermo, DERMOFFICE, Dallas.com. If you don't have it, 1 in 3 Texans will develop some form of skin cancer. So get it checked, and I would say go see Dr. Turner. All right, you've been listening to CEO with Michael Yorba. Thanks for joining with us. We'll be back tomorrow with more great content just for you.